I don't know whether you heard the sound or not, but otherwise you can easily imagine it. So what we know is that there's something which is called the Doppler effect, and that means that if we have a source of sound that travels towards the listener, it sounds like that the pitch is much higher of the sound than when the object is moving away from the listener. And the reason for this is obviously that if the object is moving towards you and is sending out a sound pulse, what happens is that because of this motion, the sound pulse is being compressed. And of course, if it's compressed, the frequency will be higher and we hear it as a higher frequency. And if the object is moving away, it seems like it's being stretched while being emitted. And so that means that it's lower. So the Doppler effect is a change, a shift in the frequency of the sound depending on the speed of the transmitter with regards to the listener. And so the frequency shift, this amount of frequency that it shifts, is really related to, is directly related to the velocity. There's a formula in order to do it. So it depends, of course, on the direction, because it's, of course, the component of the speed in the direction of the listener that is important. And again, it will depend on the speed of sound, like everything will depend on the speed of sound. But it means that if we would be able to measure how much the frequency is shifting of a certain object, we can actually calculate the speed of this object. And this is actually what we're doing, and we're doing this in continuous wave Doppler, because of course, what is important is we have to know the frequency that we send out in order to see whether the received frequency, whether the reflected frequency has changed in frequency, kind of related to the speed of sound. Keep then also in mind that we have the nonlinear propagation, which means that the frequency can change, but can double. So we have a doubling of the frequency. The other thing is also that we have a frequency-dependent attenuation, as I told you before. So if we send out a broad spectrum, what happens is that the average frequency apparently seems to change because of the fact that high frequencies are attenuated more than low frequencies. So that means that if we send out a broad spectrum and we receive that same spectrum, then because of the attenuation, the average frequency of that spectrum will have changed. So that means that there's no way we can use a broadband signal in order to look at frequency shifts. And neither is there something where we can look at frequencies that contain harmonics in order to look at frequency shifts, because the Doppler frequencies, the change in frequency because of the Doppler effect is much, much less than this effect, this bulk effect of frequency-dependent attenuation in a broadband pulse, or the nonlinear propagation when we look at broadband pulses. So the only way to being able to measure the frequency shift induced by the Doppler effect is if we would send out a purely sinusoidal wave, so a pure sinus wave with just one frequency. And if we then measure the received frequency, then the shift in this received frequency compared to the initial frequency, that is related to the velocity. But keep in mind, when we remember Fourier theory, Fourier theory says that a sine wave in the spatial domain is one frequency in the frequency domain. And it's this one frequency that we need. But in order to create one frequency in the frequency domain, we need a full continuous sine wave. So that means that it needs to be a sine wave with kind of an infinite duration. Of course, in reality, this is not possible, but the shorter we make the sine wave, actually, the broader our bandwidth becomes then, because what we know is a kind of very short pulse in the spatial domain is actually a very flat frequency. So a short pulse contains all frequencies. So we want at the same time a very, very narrow frequency, because that's the only way we can measure the Doppler shift. But that means that we need a very long pulse in the spatial domain But a very long pulse means, of course, that we cannot look at reflections anymore in order to see where they come from. Because in order to have a high spatial resolution, we said we need short pulses. The shorter the pulse, the better we can discriminate reflections from different objects, the better our spatial resolution. But in order to be able to recover Doppler shifts, we need a very long pulse, and the longer the better. So that means that actually for Doppler imaging, what we do is we use what is called continuous wave imaging. That means that our transducer is sending out a sine wave continuously and is continuously receiving also and is measuring continuously the frequency shift. But that means that, of course, if we use a sine wave, that means that we receive all the reflections at the same time. We cannot discriminate whether a reflection comes from deeper, from an earlier part of the sine wave, or comes from very close to the transducer, from the cycle that has been sent out. So that means that we lose all spatial resolution, but instead we get actually a velocity resolution. Now, this is still useful if we make assumptions on what we're imaging. And I show you here an example. So this type of continuous wave Doppler is specifically being used to measure high velocities of blood. And when we, for example, measure in the heart, we know that the highest velocities of blood are actually within the valves of the heart. So if we make a scan line through the heart, and we know that we go through the valve, that means that we know that the highest velocities on the scan line will for sure come from the valve, because that's because of the anatomy, because of the physics. So that means that it still can contain information. So what we can do is we can actually, so what we do is we send out a sine wave. We use a Fourier transform, so a fast Fourier transform, in order to calculate the frequency. We measure the frequency shift, and we can actually plot the frequency shift as a function of time. That's what we actually do here, and that's what's called a spectrogram. And since we know that the highest Doppler shift corresponds to the highest velocity, this kind of Doppler frequency that we plot is actually equivalent to the local velocity of the blood. And the envelope of this, so the highest velocities, we know that come from the valve. So this way we can actually do measurements of valves with a very good velocity resolution, but zero spatial resolution. So we don't have any spatial resolution at all if we do it this way. Now, besides using this Doppler principle, so the fact that the frequency will shift if it's being reflected by an object that is moving, so using that principle, we can actually use a different principle in order to measure the velocities, and it's based on how kind of consecutive reflections are actually changing. And that is shown here. So say that we have a transducer here, we have an object here. So we send out pulses, and so we receive the reflected pulse. And if this object is stationary, what I told you before is every time we send out a same pulse to the same object, we have exactly the same reflection. So we get this pulse reflected exactly the same with exactly the same timing. So that means if we look at a certain time point within here, and we look at the amplitude of the reflections of different consecutive reflections, and we mostly send out 10 pulses in the same direction. If we look here, what happens is that the amplitude will remain constant. Nothing is happening. Now, if we have the same object, but the same object is now very slowly moving away from the transducer, as you will see here, what you will see is that, of course, the reflections, because of the fact that every time the object has moved a little bit further, the reflections are coming slightly later. So we see a slight shift in consecutive reflections. And if now we would look at the amplitude of the reflections at a certain time point, what we now see is that actually this amplitude will start to vary. So it actually has a sinusoidal variation. And what we can prove is that the frequency of this variation is actually related to the speed. So we still call this Doppler imaging. We call this pulsed wave Doppler imaging, but it's not using anymore the Doppler effect, but now it's using the fact that we know that if we send out consecutive pulses in the same direction and we look at the reflection, what we will see is that this reflection is slowly changing, and the speed at which this reflection is changing is related to the velocity of the object. So this way, we can actually look at velocities, and here it's also another way of illustrating it. So what we see here now is this is like an M mode, so of consecutive pulses being sent out. So here, this is in the direction of the scan line, and this is as a function of time. You have to imagine this image here on the right below this image. So just split, but it goes lower. And what we see here is now that as a function of time, so when we send out consecutive pulses, we see that in the vessel boundary, the vessel wall, the reflections remain exactly the same. But when we go into the blood, we see that every reflection is slightly changing. And what we also see is that the deeper we go into the vessel, so the more that we go to the center of the vessel, we see that it's actually changing faster. And that's what we know is like when we think about physics again, we think about hemodynamics, we know that within a tube, the velocity will vary according to a parabolic profile. So at the vessel boundary, the blood is like sticking to the vessel, and the highest velocity is in the center. And so that means that if you would send out ultrasound reflections in the same direction as a function of time, you will see that the reflection that you receive will alter more, will change more, depending on the local velocity of the blood. So we can exploit this in order to measure the blood velocity, and this is what is being said here. So here we can measure the velocity as a function of time, and what you now see is that you see this kind of specular, or the spectrogram, where we see from which we call the pulsed wave Doppler, as opposed to the continuous wave Doppler, where we really use the Doppler effect and look at the Doppler shift. Here we look at the shift in between 10 consecutive pulses each time, and we now can really see, we can now decide where we measure the shift. So that means that we can look spatially at a certain position. In this case, it would be in a valve in the heart. And at this temporal position, where we look at when comparing the different reflections, we can measure this velocity. So this way, we can actually get a velocity measurement with a reasonable spatial resolution by just seeing when we look at the reflection. So by looking kind of depending on which time we compare the reflections from the same pulse or the pulses in the same direction, depending on the time that we look at a certain depth. And so at that depth, we can actually then estimate the velocities. Okay, now one thing that you will see now, of course, is because for every point in space that we want to measure the velocity, we need to send out 10 pulses in order to do one velocity measurement. So that means that the amount of images per second that we can make is, of course, 10 times lower. Because what we said before, normally your imaging is being done by one scan line, one pulse, one scan line, or even one pulse, 4 scan lines. Now we need 10 pulses for one kind of sample even of the measurement. So that would lead to terrible frame rates. So then we are trying to find ways in order to improve this. And one thing is that actually when you start thinking about it, so it's easy if we have 10 frames, because then we can implement very simple electronics in order to do it. But actually we don't need these 10 pulses in the same direction, because if we have 2 pulses and we measure how much this pulse has shifted between the 2 reflections, we can actually already know how fast this was moving. In reality, also in order to see whether it's a forward or a backward velocity, we take 3 to 5 pulses, but at least that will make it a little bit faster than we will have. Now, in order to calculate this very efficiently, what you actually can prove is that actually by using autocorrelation, we're not going to go into mathematics, but what you do is you take the pulse from one reflection, you take the pulse of the next reflection, you take 2 points, and you put this in a correlation formula, you can actually calculate the velocity. And so autocorrelators are very typical equipment that is being used for Doppler imaging. You don't need to go into details, but you just need to know that with only very few pulses and the right processing, we can actually also do a velocity test. Now, one thing which is important is that if the reflection of the second pulse has shifted more than a wavelength, we cannot distinguish that anymore from like less than a wavelength, because of the fact that it's periodically, every time it shifts a wavelength, we don't see anything anymore, or if it shifts a wavelength plus a little bit, we can't discriminate whether it was shifting a little bit or shifting a wavelength plus a little bit. This is what we call aliasing. So the maximum velocity that we can measure is related to how fast we can send pulses to each other, after each other. And if the time difference between these pulses is too long, then the shift can be so much that we actually cannot measure this velocity anymore. And this is the disadvantage of the pulsed wave system, and that's called aliasing. So that means that we have three ways in order to look at this or measure this Doppler shift. One is really sending out a sinus wave and measuring the exact Doppler shift with doing a Fourier transform to measure this Doppler shift. Or we can send out 10 pulses in one direction, look at one time point, and then actually do a Fourier analysis from the amplitude that we get at this one time point, and we can measure the velocities, or calculate the velocity shifts through, for example, a thing like autocorrelation, and then measure this velocity. So this means that we have different ways to do it. And again, just like all the imaging modalities, some with advantages, other with disadvantages. So they are and they remain complementary. So I told you before, the problem of Doppler is that the frame rates, of course, go low. So that means that if we really want to do Doppler imaging, we need to do tricks in order to do it fast. Okay, so another part that we have to quickly cover still is what's the image quality, what's the resolution of ultrasonic imaging. What I told you before, the resolution in the direction of the pulse, so the direction of the scan line, depends on the pulse length, and that pulse length depends on the frequency. The shorter the pulse, the higher the resolution. And by using high frequencies, we can have actually very, very, very short pulses and very good spatial resolution. So ultrasound in the direction of the beam has probably the best resolution of all the imaging techniques that we have available. The problem is now, if we go into the lateral resolution, so within the scan plane, but perpendicular to the scan line, or out of the scan plane, then we have a very different situation. While other modalities will be isotropic, which means that the resolution will be the same in all the different directions, ultrasound by definition is extremely anisotropic with a very high resolution on the scan line, but a much worse resolution in the lateral direction and in the plane direction. Here you see the example that illustrates the actual resolution, so in this direction of the scan line. So if we use a higher frequency transducer, you already immediately see that you have a much clearer image. But the resolution kind of perpendicular to the scan line, so within the plane, but in the lateral resolution, as we say, that actually depends now on the shape of the pulse in that direction. And when you really look at the pulse shape, you see that actually the shape of the wave that we send out, by the fact that we have to use the transducers and that we do this kind of focusing and we use this kind of different crystals in order to create this ultrasound field, in that direction, the ultrasound field is not that clean. What you see is like, if we look in the scan line and you make a cross section, you really nicely see this kind of sync function, so this nice pulse. But what we see is if we look in the lateral direction, we actually sending quite a lot of energy over a broad range because we cannot do better. And you see even that very far from the transducer or very far from the scan line, we are sending out some ultrasound energy. And of course, if we send out energy in that direction, it's being reflected, but it makes that the resolution is much worse. So the way to optimize this is by using this focusing, as I said before. So trying to concentrate the energy in as thin a line as possible by using this kind of trick of this phased array, phase shifts of different crystals. So by focusing, by making it narrow, what you see is you can actually improve the resolution. So you see here in the scan line direction, these images have the same resolution, but in the lateral resolution, so perpendicular to the scan line, the focused image is much crisper than the non-focused image, just because of the fact that the ultrasound pulse becomes too broad when we don't nicely focus it. And if we now look in the other direction, so if we would look in the elevation direction, so in the plane direction, what we will see is that actually most of the ultrasound is almost total crap in the plane direction. And we actually imaging planes, which are, even when we use some kind of focusing in that direction, can be like 0.5 centimeter in thickness. So ultrasound in the direction of the propagation of the ultrasound pulse, so in the direction of the scan lines, it's in the order of micrometers in resolution. Lateral direction is more close to millimeter. Plane direction can be close to centimeter almost. So we see it's very, very anisotropic. So that means that while it looks like these images are not always that nice of resolution, you have to keep in mind that the resolution really depends on what you're looking at, in which direction in the image that you're actually looking at. Then also, because of this, because we cannot generate these ideal sound fields, what we get is we get several kind of typical artifacts. So the fact that our sound field has this nice kind of shape in the middle, but has these kind of side lobes, as we call. So there's energy which is being lost in different directions. We get very typical artifacts, which are side lobe artifacts, where we see like mirror reflections coming from a different direction because of energy is kind of going in the wrong angle. And another very typical artifact in ultrasound is what's called reverberations, because keep in mind what I told you before, the biggest problem of ultrasound is that the pulse has to travel through the object that we're imaging and has to travel back. Now, say that in the meantime, there's another kind of reflector coming on. So we say like, the pulse travels to an object, is being reflected by that object, but of course, the pulse that comes back to the transducer is actually also partially being reflected by the transducer. And if that was like a high amplitude pulse that was reflected to the transducer, then actually a secondary pulse is being reflected later on. And of course, the reflections from the secondary pulse, when they reflect back to the transducer, we can't discriminate it from the primary reflections anymore. So it means that we have these what's called reverberations. So we have reflections and re-reflections at the transducer that will actually cause that we see images like ghost images at different depths. So these are like very typical artifacts that you will see with ultrasound. So this is illustrated here. So if we have this additional reflector, so the first reflector will reflect back to the transducer, which then would reflect partially at the transducer surface, and then would actually reflect back in double the speed here. So we get this kind of typical ghost image later on. And then, as we said before, aliasing is another artifact which is typical of Doppler. And when we look at this, so what looks like is it seems like velocities are being mirrored. So when you see something there, what you would hope is you have a nice profile of the blood being accelerated and decelerated through a valve. You see this kind of thing where we have half of the signal at the other side of the image. So that's actually because of this. Okay, so last, very, very briefly, we're not going to go in a lot of detail here because in clinical reality, it's not that important. But what we said before is that every imaging modalities has contrast agents, which can actually be used in order to improve the visibility of kind of structures that we don't see well. In ultrasound, typically blood is black, it doesn't reflect well. So if we want to see blood in more detail, what we need to do is we need to add to the blood a substance that would reflect a lot of ultrasound, so as a contrast agent. And what is, of course, the best reflector in fluid is gas. So what we can do is we can make little gas bubbles. And if we put these gas bubbles into the bloodstream, these gas bubbles would reflect a lot of ultrasound, and we would actually see this much better. And here is an example. So if we take gas bubbles, we create gas bubbles. It can be that it's dedicated or whether it's just like really kind of temporary gas bubbles. That's not so important now, but what we can see is that while water would be transparent, we can then really see some reflections in water. And here we see, for example, we can check a boundary of a layer of contrast with a layer of water, and we really can generate extra reflections there in order to get more information. Here is an example of how this is used. So here is contrast in blood vessels of the liver. So now instead of black, you see them white. Or here is contrast agents in order to look at tissue for, in this case, an infarction. But we're not going to go in detail. It's not that important because clinically it's not being used so much. So I told you how to make cross sections, so how to make slices with ultrasound images, but actually we could also, instead of sending out pulses like in a triangular way, we could actually do it in like a conic way, for example, and we can do 3D imaging. 3D imaging is used in clinical practice, but mainly to make like pretty pictures, for example, of fetuses, and then make money selling them to the parents. In clinical reality, by the fact that in order to make 3D images, we need to send out so many pulses that we actually have to compromise spatial and temporal resolution. So that's why mostly we work with cross-sections, so with just 2D images. So that's why we're not going to go a lot into details of 3D images. Okay, so the very last part is quickly about safety. General ultrasound is a very safe modality. So we actually call it that we can do non-invasive imaging with ultrasound. However, we have to keep in mind there are still some interactions with tissue. And the first thing is, of course, because of the attenuation, we have heat generation. So if we use a huge amount of ultrasound energy, we will actually heat the tissue. So there is a maximum index, so which is called the thermal index. So there's a maximal amount of energy that we can use for ultrasound to make sure that we don't heat up the bubble. And the other problem is that what I told you before is like when we have a compression wave, that means that the tissue is being compressed and is being expanded. And if this expansion of the tissue in the negative part of the wave is so quick, what happens is that we tear away this tissue. And what we actually also can do is we can create a vacuum in the tissue, which immediately fills with gas, and that is called cavitation. And cavitation is actually something that can happen. And now, for example, here we look again at the reflection of a pulse. But if we reflect from tissue to air, so for example, in the lungs, so if we go in the alveoli, which are filled with lungs, what happens is that not only does the pulse mirror, but it actually also flips. You can prove that there's this kind of shift. And we get actually an increase in peak negative pressures. And what now happens is that locally we can actually get tissue damage. And what actually happens is on a microscopic scale, because of this kind of pulling, very fast pulling of the tissue, what you get is you get a micro explosion. You really get a little gazelle which kind of implodes, and we get like a small local bomb of like 10 micrometer, which is like being exploded there at very, very high energies. And that's actually can cause some tissue problems. So we always have to take care when we have an interface between tissue and air, especially at the lungs, that actually this can do some damage. So if we, for example, have just newborn babies that have lungs filled with blood with very, very fragile tissue, we have to make sure that we don't do too much ultrasound at high energy there because it can actually create some damage. And here you see this actually illustrated. This is this kind of cavitation on a metal plate. So you see really a crater is being formed. And here you see this actually a blood vessel is locally being destroyed at very small level. But overall, the cost benefit, so the damage that we do with ultrasound, is much, much, much less compared to the information that we can gain from the imaging.